Well, my name is Marilyn Anderson, and Sheila, it is a pleasure to be here with you today at Summit View Clinic. So we're here in part of the clinic space, and we're here to talk about you. It's all about you, and I'm so excited to be able to ask you some questions because I know you have a phenomenal story.
Thanks, Marilyn. It's so good to be here with you as well, and I'm glad that you could make the time to come and see me.
Anytime. So first of all, just for the sake of people who are going to watch this down the road, I know that you have a degree in pharmacy, that you are a compounding pharmacist, that you are a diplomat fellow of the, is it the American Anti-Aging Institute or Society?
That's right.
That's right. And so can you take me through the path that was, because that's quite an impressive alignment.
Yes. Well, I did my pharmacy degree in Canada, in Alberta, at University of Alberta. This was 25 years ago. And have moved around a little bit. I practiced pharmacy in Kenya for about 5 years, and moved back to Canada in 2001, and lived in Ontario for 4 years, and have settled very comfortably here in Vancouver, in beautiful British Columbia. And well, a little bit of background about myself in terms of I landed in Vancouver in 2005, and the reason for moving to Vancouver from Ontario was we acquired a pharmacy through a friend here in BC, and that was a wonderful opportunity for us to move here to BC. And I started off as a regular pharmacy, and then saw that it had a narrow scope, and decided to broaden my scope through compounding. So I went and educated myself with 2 different specialty compounding groups, Medisca and PCCA, and I'm licensed with both of them. And I saw that there was a huge scope of compounding bioidentical hormone therapy. I ventured into that, but let me backtrack for a little bit, because one of the questions that you had was what led me to get to anti-aging medicine. And to tell you a little bit about a personal story that I do like to share, because when you personalize it, it makes it a little bit more real. Shall I say, unfortunately or fortunately, I went through an early menopause. At 37, my ovaries shut down, and I found myself in early menopause. It's not something that my mother went through, but I had been on some medication that shut down my ovaries. When I moved from Kenya, I went into a slight depression because I had too much to cope with. My husband wasn't ready to move with me, and I moved alone with 3 children, 3 very young children. And I had to relicense myself as a pharmacist in Canada, and had to manage living in this society all over again after 10 years of being away. And so I found myself in a little bit of a depression that forced me to get into some antidepressants, and that actually shut down my ovaries. Unfortunately, my ovaries never revived themselves again. And so that 1 year later, when I was pronounced menopausal, I started to look for something for myself.
At 38?
At 37. At 37. It was as early as that. So I began my menopausal therapy, I would say, 2 years later, when I found that my brain started getting foggy. I couldn't retain anything that I read. I was also now beginning to get into a particular course, public speaking, a course that more to teach religious education. It was a world-renowned religious program in our faith, and I had to do a lot of reading, and I had to do some regurgitating because I was going to speak to a large congregation. And soon to realize that I wasn't able to retain what I was reading. So I was either having to want to give up that particular program or do something about my condition. And so I found a doctor who was ready and willing to experiment on me. And so we started off with something. It was synthetic and bioidentical in a mixed patch. So for example, the patch was called Estalis. The estrogen was bioidentical, It was 17 beta estradiol, but the progesterone in it was synthetic. It was not bioidentical. So we started off with something because I didn't know anything else. I did well. I would say I did 60% better than what I started off with. So I was happy with what I had.
Huge.
Started off with this new career, which was really a voluntary, thing that I was doing for the community.
What's your passion?
It's my real passion. I still spend 50% of my time doing that, besides my profession. So that's how I started off. And I used that synthetic patch for 4 years before I converted to bioidentical hormone therapy. So while I was compounding the bioidentical hormone therapy, I decided, well, if I'm dispensing it to my patients, I ought to try it myself, even though I was so comfortable with using the patch. And so I converted to bioidentical hormone therapy, and lo and behold, I feel like $1 million with using bioidentical hormone therapy. From the 60% feeling better, I actually would say I am at 98%, which is great for me, exactly.
And what was the timeline from, you said 4 years from starting with the patch to, and 60%.
Yes.
How long did it take you to get from 60% to 98%?
Well, I switched to bioidentical hormone therapy in, I would say, 2007. And so it's been 5 years since I've been on it. And as soon as I started on it, I would say within 3 months, I felt the difference.
Oh my gosh.
Within 3 months. So basically what I was converting to from the patch was I use a biased cream, which has 2 estrogens in it. We generally produce 3 estrogens. Women produce 3 estrogens, but I'm on the 2 because the one, which is called estrone, is not very good for women. Is because it produces more breast cancer. It's known to produce more breast cancer. We do tend to produce more estrone when we start to age, and so that's not what we want to give women. So we do the other 2 estrogens, which is the estriol and the estradiol. And so that's what I take in a balanced ratio. And I also take a progesterone, which is now a bioidentical progesterone. I also take a DHEA, which is bioidentical DHEA, which is an androgen. And all of them make such a huge difference to me that actually takes me to feel the 98% that I do. I would actually say that I'm 48 years old today. And this month, well, yeah, I'm going to be 48 years old this month. And I would say that biologically, I feel 35.
You look at, your skin is phenomenal, your eyes are so bright and clear, the energy in your smile just radiates. And the way you move tells me that you feel good in your body and that your body is ready to do whatever you ask of it. There's just an ease about you in motion that comes from that kind of health.
But thank God to bioidentical hormone therapy. That is what has really changed my life. And what I decided then at that point in time, I found an institution that actually would specialize me in bioidentical hormone therapy and counseling and treating patients in bioidentical hormone therapy. So I ventured into that realm of science and was very surprised with what I was learning. It was phenomenal. But what was really phenomenal as well, so my diploma is I'm a diplomat and fellow in functional and restorative medicine. And so basically what that is to anti-age the body from the inside by balancing one's hormones and nutrition balancing as well. So
and I love the restorative piece, because that suggests to me that any woman who's working with you doesn't have to worry about what she may have lost already. You can help her get back to where she should be in her body and her mind, which is what we're all afraid of losing. Yes. And the sky's the limit from there. This is so exciting. And what I hear too is that when you talked about the counseling, when you were working on your fellowship, that it brings together the threads of your passion and your clinical background and all of that knowledge and expertise.
Absolutely. And I think that's the best part about it, because while I have a study in allopathic therapy, I see the benefits of allopathic medicine. And I also have now a new science that I have developed, which is the naturopathic remedies, and I bring the two together because they have to, they do work together in harmony, and you know, that's how one leading to one's potential well-being.
I think that there's a piece of Darwin in this puzzle, in that we are all here today because we had ancestors that survived, and the ancestors that survived because they knew things that were naturopathic or became allopathic. They had to have those tools working for them to have survived, and that's part of the reason that our gene pools are here even having this conversation. When you think of it, it just makes perfect sense.
Absolutely.
Just makes perfect sense.
Absolutely.
So in your clinical practice today, I as a patient can come to you, and I may have a pharmacy prescription from my general physician, but I can also come and see you for restorative medicine. You can help me even out my hormone levels. And is there a counseling piece to this as well?
Yes, there is, indeed. In fact, what happens is I'm glad that I run a pharmacy, and it gives me a lot of opportunity to see patients who may need bioidentical hormone therapy. And I can actually identify them very easily. When they come to me with whatever prescriptions they come with, during my counseling, I'm able to figure out that really they're hormonally depleted, or they're hormonally imbalanced, or nutritionally imbalanced or depleted. And I begin to make my recommendations right there. And then many a times I'm able to do a complete counseling with them at that point, and tell them, and I go through the full 9 yards about how we can test for their hormone levels, and how we can make sure that they're well balanced, etc., etc. So there's a complete science to it, and we make sure that we follow it. It's not ad hoc. We actually don't just treat empirically. We test to make sure that they are hormonally imbalanced, and we correct the imbalance based on where they're at, and bring them to their optimal health.
What is the best trigger for me if I've heard you speak, read something you've written, and I'm thinking, I wonder if that applies to me? Are there 2 or 3 little flags that might come up earlier than the rest for me as a patient to know that I should come and say, Sheila, can I see you?
Well, let me tell you in this way. Women start to, I hate to use the word age, but that is what I'm going to say. Because when we start to get into perimenopause, that's the time when our hormones start declining. And we're actually beginning to age right around then. And that can begin, well, aging, they say aging begins at age 35. We already begin to age by age 35. So we start to see a decline in our hormones, which really, begins with some imbalances, which leads us to a perimenopausal age. And perimenopause can start anyway between age 40 to 45, and menopause is usually categorized between age 45 to 51. That's the mean age.
So these women who are pushing the envelope of science to have their first children at 40 or 42 really have a very complex situation to deal with.
Absolutely, absolutely. In fact, talking about that, we find that with this hormone restoration or hormone balancing, we've actually managed to get women pregnant even in their early 40s, just by correcting their hormones, because we make their bodies more fertile. And there have been tremendous
without any
successes.
other artificial intervention.
That's right.
Really?
Bioidentical hormone progesterone. And we've managed to get women pregnant in their early 40s and produce healthy babies.
And healthy moms.
That's right. And that actually prolongs their menopause. It's been extremely successful.
With that being said, prolonging it or postponing it, is there any end to this? A woman comes to work with you, you've taken care of her imbalances, the restorative piece has happened, you're managing her hormone levels. Can she just stay with you forever?
My personal opinion, and science so far, and our studies have proven so far, that by balancing our hormones, we're actually making their body anti-age. You're actually stagnating them to a point where they were at their optimal. So ideally, we would say a woman is at her optimal at about age 35. That's when she's at her optimal hormone levels, energy levels, rigor, IQ, etc., etc.
Is that why people talk about their biological clock kicking in their early 30s
That's
too?
right, that's right, yes. Okay, so we can actually take a woman back to around in their mid-30s and keep them at that level. So while science has a remedy for everything today, if we want to prevent or control high blood pressure, we give them antihypertensives. If we want to control or prevent tachycardia, we give them medication to control their tachycardia or their rapid heartbeats, etc. There's a remedy for everything today. And so there is a remedy to actually anti-age the body and keep it at that level. But the benefits of anti-aging the body by balancing the hormones, because to age is natural, right? That is just because it's something, while our spirit, our soul is eternal, our body is meant to age. It's just a natural process of life. But science has proven today that by restoring hormones, we're actually able to anti-age the body and keep a person at that level as long as possible. You're not going to always remain feeling, perhaps you're going to feel as young as 35 or 40 or 50, but your aging process will be very stagnated comparatively. We can defer aging to such a large degree. And it's been shown that hormone replacement therapy is safe for a very long time. There are women who are on HRT therapy even in their 80s,
Really?
and doing extremely well. So what it does, it actually prevents bone loss. It actually prevents Alzheimer's.
I was going to ask you about osteo and about Alzheimer's. So let's talk about body, mind, and spirit, because I believe that the attitude, the mental health benefits that come along with this need to be highlighted as well, because I think that's the struggle for women today, whether they're young mothers, 40-year-old first-time mothers. If they're working full-time, they have divorces, they have houses, they have dogs that need walking, and they tend to put themselves last. And between what their bodies are faced with, what's happening with their hormones there, what that means in terms of their mental acuity and our fears of losing track of every significant detail, and then what that means in terms of attitude too, because you talked about depression, and I think that most people suffer from them, men and women, and most, I think, never are recognized or treated.
Absolutely. And I'll tell you why the woman's body is so much more vulnerable to aging as opposed to men. And women tend to age much faster. And that's because of the physiology of our body. We tend
Not
to...
just because of their husbands. Okay, this is good to know.
Is that supposed to
Well,
be...
it's always the husband's fault when you listen to it.
Well, everything's in the equation.
Yeah.
But a woman's body is meant to bear children. And because of that, our hormones cycle, right? So that's why we find that our hormones rise and fall at different times in the month. And because of that, the cycling of the hormones, that, you know, women are always known to be, oh, she's very moody, she's suffering from...
yeah, it's PMS.
PMS, exactly. Well, men don't suffer that. It's because their hormones are much more steadier. But because women's bodies are meant to carry a baby and to get pregnant, that is the reason for the fluctuation of the hormones. And of course, that makes us age faster as well, because those imbalances can continue. As you know, after every childbirth, our hormones get more imbalanced. So the more pregnancies that we have,
I didn't know that.
the earlier we can get into menopause. Right? So that's it, because the body's been through so much. Because during pregnancy, our progesterone rises so much, and then again it drops after pregnancy, etc., etc. There's such a lot of rise and fall in our hormone levels. That's right, that really causes an imbalance in our body. And we know that estrogen really is the hormone that helps us with our brain function. So when our estrogens are off, you know, we can start having foggy brain, memory loss, etc., etc. And replenishing estrogen has actually proven to ward off dementia and Alzheimer's. So this is what this new bioidentical hormone therapy has to offer.
And that impacts everybody in every family.
Absolutely, because the woman is responsible for so many things in a family. She's a bread earner, she's a mother, she's a wife, she's going to be the mother-in-law, the grandmother, etc., etc. you know.
Well, and we were talking about values and beliefs, family cohesion, and that legacy piece. As a parent, what we do for our children carries forward to our grandchildren and great-grandchildren, and it's in everyone's imperative best interest to make sure that all of these things get addressed.
Absolutely. One interesting thing that I would like to mention to you as well is when we deal with this realm of hormone restoration, we don't work with it in a vacuum. We treat a person holistically. Okay, so while we make sure that their hormones are balanced, we make sure that they're nutritionally balanced as well, that they have really good nutrition, and then we also make sure that they're it's a mind, body, spirit thing. It's a mind, body triangle. If the triangle is not well balanced, then it's going to get skewed. So we make sure that the woman's exercising, that she is either doing yoga. So there is a body, mind, spirit balance. So it actually promotes greater health outcomes.
We think of holistic health as meaning something outside of a doctor's office, but my first career was in healthcare, and going back far enough when the family physician knew all of those things about their patients. And what I see is a return to that Mrs. Smith comes to see you and you know that she has 3 children, you know that her mother-in-law is ill, you know that she has a full-time job, you know what else is going on in her world that impacts all of those things, and particularly her own innate production of hormones. And it's, as much as it is a huge step forward in science, it's also a step back to a time, I think, when we took better care of our patients.
Absolutely. Absolutely. I find that the patients who come to see me, if they come to see me early enough, and I find a lot of patients who come to see me while they're in perimenopause. Now, perimenopause is when you're not in menopause yet. And like, as I said, it's between age 45 to up to 51. And menopause, the definition for menopause is when you've not had a menses for a whole year is when you're considered menopause. Until then, you're still in perimenopause. And perimenopause is when our hormones really fluctuate a lot. And so we go through a lot of mood swings.
Is that the first noticeable?
That's right.
Example?
That's right. That's the first noticeable example. And so I have a lot of these young women who are deep into their careers, who find they're not able to focus at work, their marriages start to suffer, they have children who are in university, most of them, or even some of them, if they've been late parents, they have younger kids and they're not able to cope. And luckily enough, they come to me sometimes presenting with a prescription for an antidepressant.
I was going to ask you that. Yes.
You know, and I've had several patients like that. So they come with a prescription for an antidepressant, but very reluctant to take it. And during my counseling session, I realized that they do not really want to take it. And so I will sit them down and I do a symptoms analysis checklist with them. So that's the first level of approach. So before testing, I give them a sheet of paper, which is a symptoms analysis checklist, and they will tell me what they're suffering from. And there's 20 items on the checklist. And right from there, I'm able to identify that they are in perimenopause. So what I do next is I try to convince them to do a test. And we do a saliva and a blood spot test. And that tests about 9 different hormones in our body. And when those results come back, I'm able to exactly identify what they're imbalanced in. So in this particular test, we test estrogen, progesterone, DHEA, testosterone, 4-point cortisol, and thyroid hormones as well. And we need to make sure that all are well balanced for our bodies to function at this optimal. And we're able to do that very successfully. Women suffering from perimenopause within 3 months of treatment are able to feel extremely well and are able to get back to normalcy soon after that. And then they have to remain on that hormone therapy. And some of them are able to, if we start hormone therapy early enough, they're able to prolong getting into menopause.
Can we talk for a minute about what those cortisol results indicate to you? Because I think that cortisol and thyroid symptoms are prevalent in probably 90% of the people we see on a daily basis, and we don't know what the indicators are, and I think that therefore we don't even go and seek medical advice. So can we talk about, let's talk about the cortisol first and then the thyroid, because you've already talked about the hormones balancing before this. Okay.
Yes. cortisol is our flight or fight hormone, just as adrenaline is. Okay, but cortisol, in a similar way as adrenaline, is actually produced when we are succumbed to an unusual situation. Our adrenaline rises, but cortisol is our tiger within us. It's what wakes us up every morning, and it's our fire hormone. So we need an adequate level of cortisol hormones. But if we get stressed, or if we're in a stressful situation, it could be any sort of stress, our cortisol levels rise. Cortisol is an inflammatory hormone and causes an inflammation of the body. And once our body starts getting inflamed, it actually invites diseases. Okay? And who isn't stressed today? Right? We all suffer from different kinds of stresses.
Well, it's interesting you talk about it being the fire hormone, and we use the term burnout all the time.
Absolutely, absolutely. The demand on our time is tremendous today. For a woman that has to make sure to go drop off their kids to school or to daycare, and then head to work, and then picking up the child at 3, 4 o'clock in the afternoon, coming home or after work, having to cook, tend for the family, making sure the laundry gets done.
The grocery shopping.
The
cat is fed.
That's right. The husband is looked after, etc., right?
Yeah.
And then have to make sure that everyone's in bed before she herself retires for the night. So, we're on the go.
That was my
constantly
mom.
on the go.
And I have said to my sister, if she had a sweatshirt, it would have said, it will be my turn last. It will be my turn when. And when was always when everybody else was taken care of, including the family cat.
Absolutely, absolutely. That's how women are made.
God rest her soul.
That's right. That's the nature of women. Unfortunately, we give, and we never stop giving.
Well, part of that maternal extrapolation.
Absolutely, absolutely. And that really causes a burnout. You can imagine as a woman how it is to be a mother and a wife and all of that put together.
I have that sweatshirt, exactly.
Absolutely. So that's what happens. So while we don't want a low cortisol either, because that does not get us out of bed in the morning. We need an adequate amount of cortisol to get us out of bed in the morning.
It's that diurnal relationship, isn't it?
Absolutely.
Night and day, so that
Yes.
our bodies, our clocks do
That's
what they're
right.
supposed to do.
And cortisol is that it's highest in the morning, and then it dips at around noontime, and then it rises again and dips again. So it has a certain way of managing itself during the day. And it tends to rise with something as little as a woman panicking that I need to wake up to drop my child to school, to prepare their breakfast.
What about a crying baby? A mother wakes up in the middle of the night to a baby crying. Does that stimulate the same
Absolutely.
response?
It's amazing what stimulates cortisol. You must have heard of terminology called adrenal fatigue. Adrenal fatigue typically is when our cortisols are totally off balance. So it could be if our cortisols are really low, but adrenal fatigue is also when our cortisols are too high.
So that running so fast on that self-created
right.
hamster wheel
That's right.
that we are afraid to stop in case we don't get started again.
Totally tends to shut down our adrenals. It's called adrenal fatigue. And you will be surprised, 70 to 85% of women suffer from adrenal fatigue. It's the syndrome of too tired and wired.
The adrenals are fatigued and we supplement with caffeine? Is that what happens?
That's right. No, what happens is when the cortisol rises, and it tends, because it's the tiger within us, while and adrenals are getting fatigued because it's not helping to balance out all the other hormones and causing an overproduction of cortisol, it also causes, it has the caffeine-like effect, and so causes the wiring effect as well. So even though we're thoroughly tired by the end of the day, when we go to sleep, we're not able to sleep because we're wired.
I was just thinking of all the places in situations in life, whether it's a car, somebody honking at you when you're driving, or in healthcare where bells ring and somebody's yelling stat, it's an emergency, someone's life is on the line. It's like push a button, push a button, push a button.
Absolutely, and that really tires out the adrenals.
School teachers, just I can't think of a single profession
Absolutely.
where it is not endemic in the workplace. So let's go to the thyroid and talk about that and then see how these all marry together.
So thyroid is another extremely important hormone, and it needs to be very much in sync with the adrenals. So we have a triangle. There's the thyroid hormone, there is the adrenals, and then there's the pancreas, right? And if these are not in balance, then our body won't function in sync. So pancreas, of course, produces insulin. So our insulin, our adrenals, which produce our sex hormones as well, and our thyroid has to be in sync. So when that's not in sync, we'll never function at our optimal.
With the pancreas involved in this equation and the noticeable rise of obesity and the associated, hypertension, cardiac stress, all of those other things that blood sugars that are out of control can bring to, or the subsequent layering of medications to control that. Do you see hormone replacement therapy and regenerative medicine helping to tip that back in a normalized direction?
Absolutely. Absolutely. I'm so glad you've asked that question, Marilyn, because studies have proven that estrogen reduces blood sugars by 20%. Studies have also proven that testosterone in men drops their blood sugar by 20%. So restoring hormones not only helps women in their diabetes, but also helps men in their diabetes management. Wow. It is incredible, and this is tried and tested. I have several diabetic patients who are well balanced on their blood sugars because of supplementing on testosterone, and women on estrogen.
So where are we in terms of the general practitioner who sees potentially me? I'm not diabetic, fortunately, but let's say I was, and I went to see my GP and the blood sugar levels are out of whack and they're treating me with what they are wont to prescribe. Where in that equation would they refer me to you, or would I only find you if I was lucky enough to come here with my prescription?
I would say, unfortunately, in Canada, bioidentical hormone therapy is an emerging medicine. It's an emerging specialty. And while it's on the rise, it's much more prevalent in the US. There are a lot of physicians who co-specialize in anti-aging medicine along with their own specialty. So we find that in the US there are gynecologists who have an anti-aging specialty. There are internal medicine specialists who specialize in anti-aging medicine. There are primary physicians who we call GPs here in Canada who have an anti-aging specialty. So you're more likely to end up with a physician who has these specialties in the US than in Canada. Unfortunately, I'm sure there's a very small percentage of doctors that you end up with here. Now, I personally work with physicians. Physicians send patients to me, and I send patients to physicians, and we work completely coherently together and in diagnosing patients who are deplete on their hormones. And in Canada, unfortunately, it's usually word of mouth or bumping into someone who's had this kind of therapy, or through the internet, or if they're just well read on their own. So the likes of Susan Somers and Dr. Pamela Smith and all of these other wonderful physicians who are writing about it, people tend to read about them, and the word gets around. And so I'm hoping that in the future there'll be a greater awareness of bioidentical hormone therapy and its benefits on various disease conditions. And I'm hoping also to start up a support group. I have patients who constantly tell me, why don't we start a support group so that we can have more and more women who will join the support group and we can share our personal stories with them.
I not only am all over that, but I want you to start support groups on Google Hangouts, because that way women from all over can meet and be part of that circle of support and have that engagement and interaction with you, because they may live in a small community in northern Manitoba and not have access to something or someone who can guide them. And one of the beauties of the technologies that support us in life today is that you can have that instant access to people.
Absolutely.
And that is phenomenal.
That would be wonderful. This is my way of giving back to the women in society. I personally feel that women go through so much. When it's time for them to now lead a life of their own, when they're empty nesting, they unfortunately go through a decline, in their lives, and they start to rapidly age. And because of the benefits that I have experienced through bioidentical hormone therapy, where I feel like I've completely reversed my aging process, which started at age 37. At age 37, I felt like I was age 65. And I totally lost hope. And even though I went through my struggles of finding the right balance of hormones for myself, I took it upon myself to educate myself on it so that I can give back to the women out there who suffer. You know, on a daily basis, I see women, older women, senior women, aging women coming into the clinic, being treated for Alzheimer's, for dementia, for bone loss, for all of those, you know, detrimental conditions, aging conditions. And I feel like if we start early enough,
It's preventable.
it's very preventable. It's very preventable. There have been several studies to prove that.
I'm just thinking about the companies and the industries and the professions and professional groups where things like employee support programs are available. And they're happily sending and paying to send people discreetly and privately and confidentially to talk to a clinical psychologist, or maybe take their teenager to a clinical psychologist. Nobody that I know of is offering them this kind of support, which would make some of that other intervention unnecessary. And we were talking before we started this conversation about the effects of one woman in a family and in her community and in society, and that the plagiarized colloquial quote that if mama's not happy, nobody's happy. And, you know, happy wife, happy life, we hear sometimes.
Absolutely. You know, funny you mentioned that, Marilyn, because I was just reading about a study that was done in the U.S. And it was one of our mentors, Dr. Pamela Smith, actually, who is the director of the American Academy of Anti-Aging Medicine, who was talking about it. And she said that there was a group, they had approached a lawyer's firm, a law firm, and they had decided to put a group of women who were above 50 on HRT, on Bioidentical. And they found that after a year of being on it, that their IQ had increased by 7 points.
Holy smokes.
Increased by 7 points.
Yeah.
Now we know that how much lawyers need their IQ.
Yes, and what we expect, we anticipate. We are looking for any sign that actually that number is going in the other direction.
Exactly, exactly. So this is just one study that I'm mentioning.
But
there are several studies like that that have been done.
And how often have we heard about what we term work-life balance?
Exactly, that's right. I'll tell you, when I was going through my stages of menopause, I felt that I would never be able to enjoy a vacation thoroughly ever again with the way I felt, you know. I'll share another personal story with you. My husband's diabetic, and he became diabetic at age 40. And again, you know, we know what diabetics suffer from. Constant adrenal fatigue, just, you know, generally getting, you know, thoroughly pooped out by 6 o'clock in the evening. You know, he would become a couch potato right at 6. And it was a spiraling effect on his life.
And the whole family.
I tell you, it played very badly on my teenage children. And at that point I was beginning to lose hope. Talking about vacations, I was saying, I don't know if I'm ever going to be able to enjoy a vacation. Now, I was on the mend, but he wasn't on the mend.
And this isn't fair.
That's right. You know, and I'm saying, hey, I'm anti-aging, and where are you at?
Yeah.
And lucky for me, when I started taking my anti-aging program, the first thing that I learned in one of the early sessions was when you supplement men who are low on testosterone, which is very typical of diabetic men, that it
Of course,
reduces...
because it goes hand in hand.
Yes,
doesn't it?
absolutely.
Cause
Yes.
and effect.
That's right. And the triangle, again, it's imbalanced. That that if you supplement them with testosterone and DHEA, which is another hormone that they're usually low in, and to the optimal level, to the physiologic level, that increases the effectiveness of their diabetic medication and reduces their blood sugars by 20%. And we tried him on it, and lo and behold, he is doing extremely well today. If I could invite him into this interview, I would. And
we will do this again, and we will invite him in. Yes, absolutely.
He is doing extremely well, and guess what? I'm enjoying those vacations.
Isn't that wonderful?
Thoroughly, and he leads an extremely productive life now. He works sometimes right until 11 in the morning. We are very church-going people.
Did you mean 11 at night?
Sorry, 11 at night. We are extremely proactive in our church groups, in service to the community, and he is on the go. So he wakes up by 6, 7 in the morning, and is on until 11 o'clock at night. It is incredible what it has done for him. So again, it's not only the hormones that we balance him with, but we nutritionally balance him as well. So make sure that we give him enough vitamins to nutritionally balance him as well. So all put together, he's doing fabulously well.
And that would be true of any diabetic?
That would be true of any diabetic.
Now, one question I want to ask is about that sort of pre-diabetic phase that often goes unrecognized, and what an indicator might be to be moving in your direction, because sometimes it's familial, and sometimes people have a sense that something's wrong and don't know where to go. The other thing I'd like you to address or comment on for me is this: when mammograms first became the test du jour at, 20 years ago or so, the common thinking was every woman on their 40th birthday should have a baseline mammogram, so they had something against which to compare. Would you suggest or think there's value in a young woman at 30 coming and doing that checklist with you and having those tests done? Because even if she's not out of balance yet, now you have a baseline for that same point of comparison?
Absolutely. I really think it's key.
Oh, good.
But a few things that are at play here. One is women who are on birth control pills, or who are on IUDs, which are hormonally, have implanted, right? Both of these do tend to imbalance hormones, because birth control pills and the birth control methods in the IUD, the hormones in the IUD, are both synthetic, and so they're inevitably imbalance our hormones. They, unfortunately, they cause more harm than good over the long run. And so that tends to put women into perimenopause much earlier. So while we need the birth control pills as a birth control method, or the IUD as a birth control method, because we've still not managed to develop a bioidentical hormone therapy birth control. We're in the project. That's right.
But of course, you mentioned earlier that the more pregnancies a woman has, the earlier she's going to go into perimenopause or menopause. And a young woman on the birth control pill is basically inducing pregnant, not pregnant, pregnant, not pregnant in her body month after month. So it makes perfect sense that that would accelerate.
Absolutely. So there's those two aspects about birth control. And the other two conditions that we tend not to look at very often, one is endometriosis. And the 10% of women suffer endometriosis.
I know a young woman who is delightful, generous, kind, bright young woman whose life is being absolutely decimated by a very severe form of endometriosis.
Endometriosis is when we produce too much estrogen, and so that causes an overproliferation of our cells in our female organs. And so right there we're talking about an imbalance, which again
we do need to talk. I so want to introduce her to you. I did not know that.
So that itself is treatable through bioidentical hormone therapy. We can balance out those hormones. So we know that women not only suffer some really painful periods or menses because of endometriosis, but also they find it very difficult to get pregnant as well. And by balancing out their hormones, and I've actually had success with women who I have treated with progesterone who got pregnant very successfully. So there again, bioidentical hormone therapy helps endometriosis.
Is there ever a situation where it would be not in a woman's best interest to use bioidentical hormone therapy? Is there any contraindication to it at all?
To be very honest, there is not. And the reason I say that is because estrogen therapy, bioidentical estrogen therapy and progesterone are actually they actually prevent further cancers in women.
So the bad press that we have seen, in a decade past about hormone therapy was because it was synthetic hormones that were not bioidentical, and so there were side effects that went as far as causing those sorts of situations.
That's right, yes. And the big study that you must have heard of was the women's health, the WHO study, right, that came out that talked about how and that study was women who were followed on synthetic hormones after 10 years that actually developed a higher incidence in cardiac disease and a higher incidence in breast cancer, along with other conditions as well. And that was as a result of them being synthetic hormones. Now, synthetic hormones don't sit into our receptors very well. They don't fit hand in glove with our receptors, and they don't stay there long enough either. So they actually distort our receptors. So if this was square and this was round, and you're succumbing this to the receptor, it actually changes its shape. And
does the synthetic hormone, as an adjunct to that, do anything to one's blood sugar mechanisms, like the insulin receptors? Are they affected? Is there a connection between synthetic hormones and diabetes?
Everything gets affected in the body. You will be quite surprised. So studies have proven that it does affect cardiac health. It does affect diabetes as well. So basically what we're saying is that by
get the synthetic stuff out of the way,
exactly.
and let's use something that's absolutely bioidentical.
Exactly. Okay, it's something that's completely bioidentical to our human body, and it accepts it hand in glove. It stays there longer, and it actually prevents cardiac events. It prevents breast cancer, even if you've already had breast cancer. So it actually prevents, but the most important thing is maintaining your hormone at physiologic level. We don't want it higher than where it should be. We don't want it lower than what it should be. We want to maintain it at its physiologic level, and hence the testing part becomes very important.
Is there a regular rhythm to testing?
Yes, there is. Ideally, I ask my patients to test every 6 months, and then once they've completely stabilized and they have no symptom issues, then they can test every year. But we recommend testing on a regular basis.
What is your prediction of where this is going to be in, say, 2 years, 5 years, 10 years? Because you, I think, have seen, you know, the upturn in awareness, and obviously in your ability to be a certified professional with this focus. And the more people who know about this specialty, the more questions there are going to be. We're women. We tell our friends, you've got to go see here. Have you heard this? Look at this. You need to. So in terms of advances in the community for acceptance and demand, and advances in where you see the technology behind this maybe taking us down the road?
Well, there's a few things at play. One, we're finding that the baby boomers today are more educated.
Well, we're not going quietly into that night.
Exactly, right?
No so rocking chairs and canes, a friend of mine says.
Exactly. We're much more educated. We surf the internet all the time. We look for answers. And there's tons of material.
Oh, yes, not just information, solutions. You're absolutely right.
Absolutely. So the average woman is much more educated today. The average woman is educated in terms of surfing the internet, reading books, etc., etc. But also we're more career oriented today. So there's this talk in the workplace that goes around. There's more physicians who are writing on BioHRT and their successes. So there's more reading material out there. And the studies are ongoing. So I just see that we're going to be changing our lives by leaps and bounds.
Do you get invited to speak on this topic?
Yes, I do. I speak to a group of gynecologists. I speak to pharmacists about it. I've spoken to physicians. And I speak to groups of patients as well.
Well, I was thinking of the BC Registered Nurses Association and the BC Teachers Federation.
That would be marvelous.
Just off the top of my head, as two places where you're aggregating people who are dealing with all kinds of red lights and red flags in their professional lives and having to balance all of those issues, and predominantly women.
Absolutely. Marilyn, I look to you to open up
We've got to open some doors here.
Yes, that's right. So what I have, my newest venture actually has been, I was born in Kenya, and I return there often because my mother and family still resides there. And so my newest venture is actually reaching out to women in Kenya And this is going to be my second trip to Kenya. I'm leaving next week, and I'm going to do a series of seminars there. I was there in December, which is 5 months ago, and I came back with great success. And the women are doing extremely well, and they're extremely excited for me to go back. And they want to invite their friends and their mothers and their sisters to these seminars. And so hopefully that will be a good change for me. It's something I can give back to the country I was born in. So.
Oh, I can't wait for the stories, the photos, the results, and more chances to talk about this. This has just been an extraordinary opportunity. Thank you so much. Now, what would you like to leave me with? One last thought, topic, question I didn't think of?
You know, Marilyn, I think that it's about taking personal onus about knowledge. And if God has bestowed you with knowledge and with good health and with all things nice, then it's about giving back to society of what you know, selflessly. And I'll tell you that I have women who come into my pharmacy who, you know, I'm not bound to spend time with them. I'm bound to spend 5 minutes with them to counsel them for their medications. I end up spending sometimes half an hour to an hour with them without charging them at times. Most times, I'd say, because they just walk in with a prescription, not expecting that I'm going to give them a consult, but I do end up giving them that half hour, 1 hour consult because it hurts. I feel it. It's something that if my health has been brought back to normalcy, I owe it to someone to give it back to someone else as well. It's about paying it forward, and I think that's extremely important. And I'm so passionate about this that today there's help for everyone out there. And I think that women suffer enough. It's time for them to enjoy their lives when they hit 50 and when they are empty nesting, and it's time for them to now say, the rest of my life is for me.
One body, one life, make it happen.
That's right.
Oh, thank you so much.
I take personal pride and enjoy in doing what I do. Thank you so much, Marilyn, for being here today.
We'll do this again.
Yes, thank you.
Thank you.